to the To Your Health podcast, your go-to source for everything health, wellness, fitness, and the latest medical insights. I'm your host, Rhonda Alfred. Joining us today is Dr. Sina Pourtaheri, an orthopedic surgeon at Gulf Coast Orthopedics and Terrebonne General Health System. Welcome to the show, Dr. Pourtaheri.
Thank you for having me.
Is it all right if I call you Dr. P?
Yeah, that's fine.
Okay, good. All right, well, let's get started with you telling us a little bit more about how you got to Houma and how you landed at Gulf Coast Orthopedics.
So I'm originally from Louisiana. I grew up in New Orleans. I went to Ben Franklin High School near UNO campus. I did the Tulane's pre-acceptance program to medical school. So I did undergrad and med school at Tulane. Afterwards, I moved to New Jersey, did my orthopedic residency at Seton Hall University. After that, I did my fellowship in spinal surgery at the Cleveland Clinic in neurosurgical and orthopedic spine surgery. Then I started my career at UCLA and UCSD. I was in Southern California. I developed a large research program looking at different things in the lab and clinically with patients. One, our focus in the lab was specifically trying to get patients to walk again after being paralyzed. We were able to show that we could get the mice to walk again. And we're continuing those research here in Louisiana. Specifically, I have a lab at Tulane, and we're partnering still with our partners at UCLA and in Italy doing that research. And then I wanted to move back to Louisiana to be closer to family. And the good part, I still can keep those connections and still continue to run the lab and do the research and while taking care of the patients at Houma. So it's been a very exciting opportunity.
Today, our subject is the future of spine surgery. So let's get started talking about that since you have all this research background, and I'm sure you're applying that to the things that you're doing here for patients. So can you tell us, when did you first start practicing?
So I think it was in 2016, I started my practice at UCLA. And then and I think the exciting things about spinal surgery, it's really evolved over the years. Beforehand, spinal surgery, during our training used to be big incisions where you're stripping the muscles off the spine. Mm-hmm. Nowadays, we can do these same spinal surgeries, do small cuts the size of a Band-Aid, still address the pinching of the nerve of the spinal cord. However, you can maintain their bony and soft tissue structure, not like before where you're stripping it all off. So patients are now traditionally going home same day with these minimally invasive procedures versus beforehand patients would stay in the hospital 3 days and up to a week. And it's kind of impressive how spinal surgery has changed so much over the years because I was also involved in research before my training of how they used to do lumbar fusions. They used to take a chisel, take a big piece of a patient's pelvis, put it in their back, close up, and then put them on their cast or back brace for 6 months. And it was almost, does it heal, doesn't heal? It was a little bit better than 50-50 odds in terms of improvement and also if it actually took. Nowadays, we can get very predictable results with spinal surgery because it's evolved so much over the years. So it's a very exciting time in spinal surgery. And I think as surgeons, since we really appreciate our craft, we're always trying to figure out how to do things better and better. Mm-hmm. And at Gulf Coast Orthopedics, our focus has always been there. So that's why we present at conferences, partner with some of the companies and teach and learn from other surgeons so we can learn from each other and grow as surgeons and improve our craft.
Well, I understand you take a more conservative approach to spine surgery. Can you tell us about your care approach?
I take a very conservative approach with spinal surgery. I treat everybody like it's their family. So surgery is a last resort for me. I think the best surgery is no surgery. But in certain cases, you can't avoid that and you have to do surgery. But I think the more important thing than just conservative approach is treating patients as a whole. We've shown through our research, when you treat a patient as a whole and not just focus on their neck or back problem, you can have significantly more improvement in their outcomes. You can actually double the amount of improvement they can have in pain and also in function. Mm-hmm. And they also are more active in life with these measures when you address the patient as a whole, when you treat all their problems and not just the back problem. And so we're doing further research on that. And I think that's where spinal surgery is more going. We've gotten to surgeries where it's through a cut this small. You can even do it through an 8mm portal. And so surgery eventually will get smaller and smaller, where it's almost through a needle, similar to how cardiac surgery has evolved over the years. It used to be open heart surgery where you crack the chest open. Now you can do this through a catheter and put these implants in when it comes to cardiac. The same thing is with spinal surgery. So, but the amount of improvement we can get in the surgery is getting close to a plateau because there's only so much smaller and less invasive that you can get, and we're pretty close to that where patients going home same day. But the part that you can really improve is addressing the patient as a whole and not just focusing on the back problem. And I think
Gotcha.
as surgeons, sometimes we want to perfect our craft and we get focused more on the technique. And I think that taking the patient as a whole is actually more important.
So, what are the two main reasons that people come to you for back surgery or spine surgery?
The most common reason is that they have a pinched nerve. So they'll have pain radiating down the arm or down their leg with numbness and dysfunction. And they'll also have neck and back pain associated with that.
And what is the most common surgery that you perform?
The most common surgery is a minimally invasive decompression of nerve, again, is an outpatient procedure. We call it a minimally invasive microdiscectomy with laminotomy and decompression. And so it's pretty amazing how beforehand these used to be big cuts. Now we can do it through cuts smaller than a band or the size of a Band-Aid. We can preserve older bony and soft tissue structures instead of stripping it how we traditionally did, and patients can go home same day.
That's amazing.
Yeah.
What is the ultimate goal that you have for your patients?
The ultimate goal is that when they come to an appointment, I want to know that they're being heard and that we care about their problem and their disease process, and that to have hope that we're going to get them a better quality of life and make it so they can have a fulfilling life with their family and friends.
Most of the time, people wait till they absolutely cannot take it anymore, the pain. What would you say to someone like that?
Pain shouldn't last more than 6 weeks. So I think if you're having pain for greater than 6 weeks, you should see a healthcare provider. I would tell them that you don't always have to live in pain, and that there's options without surgery to get them to live a quality of life.
What is some of the ways that patients can protect themselves before they, even get to that point?
Well, I think a lot of spinal problems deals with genetics, and so some genetic components you can't change, but some newer research is showing that actually that you can actually change your DNA and make improvements on that. But besides that, a lot of it is going to be diet, nutrition, lifestyle, and preventive measures to prevent you from having back and neck pain. I think a lot of patients, if they don't have the proper posture and stand not as in an erect position with proper biomechanics to the neck, then more likely you'll have a neck or back pain. So there's some things that we have control in our life. And at Gulf Coast, we kind of look at these different variables and how we can optimize people that have these, so we can either prevent them have surgery, or when they have surgery, it can have a better result. So one of the things we're actually looking at is specifically vitamin D, and checking a patient's vitamin D levels and maintaining adequate vitamin D levels throughout their perioperative phase, and see how that does with healing. So I think we're very invested in finding out more about the patient and how can we do things better, and working as a team to address these difficult problems, neck and back pain.
So if you don't have enough vitamin D, what kind of problems occur?
Well, vitamin D, again, a great source of it is from the sun, but a lot of people think that's particularly for your bones and optimizing the strength of your bone, but it also plays a role in healing, and it also serves other functions besides the ones that everybody realizes with osteoporosis and preventing bones from becoming fragile.
So can you just take a supplement to help with the vitamin D?
Yes, you can take a supplement. Also finding out why do people have a vitamin D deficiency. At Gulf Coast, we have a bone health appointment where gamma tests are done, and we also get a DEXA scan to determine the patient's bone quality. So again, it's about optimizing people and getting them the best result.
Right, treating them holistically.
Yes.
Tell us a little bit more about your research and how you're applying that to your patients.
It's very exciting. I think most of research in spinal care is going to move more towards not so much as focusing on the craft and the surgery itself, however, addressing the multitude of issues they can have. So when people have neck and back pain for a long time, some patients come to see me, they had decades of neck and back problems. Yes, they have a structural problem to their neck or back. However, a lot of more things are going on. When you're always in pain, it affects your pain pathways, your limbic system of your brain, and a multitude of things. And our research has shown if you only address the mechanical problem, you can make improvement. And however, the improvement can more than double if you take these in account and do surgery or without surgery. So it's very important to do these different things. And so at Gulf Coast, we're constantly seeing what we can do to improve patients' outcomes. And we're continuing that same research that I was doing before. We're continuing it here with our patients and looking at everything. Oh, an interesting topic we're also looking at specifically spirituality and how that can affect healing. So a patient's faith in God, how does that affect their healing and when they're having a spinal surgery or non-operative care for their spine? So we kind of hit this head on and have a lot of teams, and I think a team approach to people having neck and back problems is the best way to solve a difficult problem.
And that outlook, the patient's particular outlook on their hope to get better, I think helps a lot as well.
Yeah, so again, if these patients have decades of back pain, they lose hope. They only see that there's no light at the end of the tunnel. And so if they've been not mobilizing, staying kind of decrepit and hunched over for years and not mobilizing, if you go ahead and just, even if you do it minimally invasive through a small cut and unkink the nerve, you're still be in that contracted kind of fearful state of always thinking that there's no light at the end of the tunnel. However, if you address all these issues and optimize them before, mobilize them, get them moving through some of the pain they had before surgery, and have a healthier relationship and feel more involved in life, then when you do a surgery and continue that protocol, then they'll live a fulfilling life. It'll be more of a slam dunk in terms of operation. And so you'll be addressing the structural issue, but the patient as a whole. And so I think a lot of research in spinal surgery is going to be more moving towards multidisciplinary approaches and how multidisciplinary approaches affects patient outcomes. Again, as we alluded to before, there's only so much more that we can improve the surgery because it's gotten so advanced. There's more squeeze, or you can get more if you focus on the patient as a whole and these other factors, again, that can improve them. Again, we showed that with some of the things that we did, that we had 100% more improvement in pain improvement after surgery and 100% more improvement in function with that. So it's with these different techniques, you can improve it another 5%, 10%, but there's a lot more that can be had by looking as a patient as a whole and these different things they can do to improve their quality of life.
Well, that sounds amazing. That's what everyone wants to be, pain-free and able to do the things that they love.
Yes, sir.
Well, thank you so much for your time today and all that you're doing in research and development for orthopedic patients.
Yeah, I appreciate it. Thank you for having us.
For more information about spine surgery at Terrebonne General Health System, visit tghealthsystem.com. Thanks for joining us today. Don't forget to like, share, and subscribe to our podcast where you get your podcasts.